Thank you very much. I'm talking about the guidelines updates why and how of the modern medical practice. First of all, let me remind you about, in fact, engineering guidelines. There are many works rely on guideline flowchart to implement their services. Medical guidelines are now taking a growing size in the current medical practice because of what we will talk now. Clinical guidelines are practical instructions. They consist of a sequence of procedures and measures to be followed by the medical staff for the management of specific disease or a condition. Some guidelines, are designed to manage certain disease, like the guidelines for treatment of diabetes or hypertension or any vascular or surgical or medical diseases which are diagnosed. And some are designed for the casualties for treatment specific group of presenting symptoms like children with diarrhea or with dyspnea, chest pain, etc. The components of the guidelines, as you know, rely on composed of several components. They include the service delivery policies, the service delivery standards, and the clinical guidelines and protocols which are to be implemented for certain disorders, disease, and presentations, and the clinical management plans which are showed as flowchart or points to be followed by the medical staff in order to manage the condition. Why the guidelines are important? Because they provide practical and they are specific management point for the patient and not waste time, limit unnecessary measures, and they encourage the sense of responsibility and accountability by the medical staff. Why should guidelines be updated? The updating of guidelines is a continuous procedure. Of course, no guidelines are strict always, and every day revision should be take place for these guidelines. It is important to be updated to improve access to high quality of service delivery. High quality service can be built or strengthened continuously and reduce medical access barriers which are faced by the during the practice, standards, and to standardize provider practice to make the standard practice for the care provider and doctors. They guide the content for in-service training and pre-service education programs. They are highly aiding for the training for the medical staff. They guide supervisory and management system for the governmental purposes, for the institutional purposes. They help to revision for the policies and the management system as a whole. They improve standards for monitoring and evaluating quality quality of care. This is beyond its humanitarian and ethical standards. Also to ensure broad scope of commitment by the staff for the procedures to be and the service to be presented for the patients. Updating of guidelines rely on continuous guidelines revision, and the revision is a vital task. Day by day, the research shines new light on our understanding of human development, disease, technologies, advanced device advances, approaches in the diagnosis, approaches in the treatment, and the clinical trials, trying to make reach easier, best patients. These all are growing processes. They interact and need continuous revision to update the guidelines accordingly. Steps of guidelines development, they get how can we take the road to develop the guidelines. It's a huge matter, and it relies on many resources. For example, many feedback, many information from the opinions of the patients, of the care provider themselves, and the whole skeleton by the institutional and governmental legislations that control the medical practice. So steps of guideline developments get input from all levels of health service, all levels related to the health service. The system pyramid itself, skeleton of the system within this institution or within the health governmental system as a whole, to identify the practices that are positive. Continuous identification of beneficial medical practices is a main source of guideline development. To conduct a broad debate on proposed guidelines, there's continuous discourse about this guidelines between the peer doctors or peer professionals. Utilize national and international resources. For example, the WHO guidelines for the institutional professional guidelines to be compared and to be updated according to and take the beneficial points. Successful examples, they propose themselves to be part of the guideline development. To identify the target audience, we should. This is very important to reactivate the guideline and to make it more specific and more service providing. They need to be. There's always need to be clear, updated information, and to make it easier for the clinical providers to be implement these guidelines, because difficult and complex guidelines are difficult to be applied. Finally, the limits of updating the resources of updating the technical fields related to the medical providing services for the instruments, for the devices is important. Reference for the diagnosis and the treatment. Reference documents and resources, the guidelines and major points that is issued by different institutions, and at the top, the WHO. And as we said, in the coronavirus pandemic, all the medical institutions were following these instructions and updating their guidelines accordingly. The drug development updates are a major limb of guideline updating. Any new drugs, any new more effective, less costly drugs are important to be included in the updates of the guideline according to the dose, to the frequency, etc. Review for technical accuracy. Use friendly formulation, up-to-date guidelines. As we said previously, revisions should reflect client perspectives, what the patient expect from these the service. What are the opinions of the clients and service, the people who are benefiting from the service, their opinion are important part in the updating of the guidelines, and feedback form for the patients, clients, and for the healthcare providers is important in the revision of guideline updating. Also, a new light of guideline updating. Another important limb is the authorities